Hi everyone, this is Megan. In my case study for the Midterm OSP is Sarah. She's a 20-year-old female college student who presents to the clinic with sore throat and difficulty swallowing for 3 days. She denies sexual activity but does admit to unprotected oral and anal sex. Sarah is also allergic to penicillin. Subjective data I want to start with would include old cart regarding her throat pain. I would ask her what she's done to help alleviate the pain, whether anything makes it better or worse, and then move on to more specific subjective data. Has she had fever, cough, shortness of breath, headaches, earaches, muscle aches, extreme fatigue, neck pain, night sweats, any nausea, vomiting, diarrhea, difficulty urinating or painful urination, any sores, lesions in her mouth or around her lips, and any painful bowel movements. I then want to move into her social history, so I would assess her use of alcohol and recreational drugs, smoking history, any history of sexually transmitted infections in the past. I would also want to get more details about her penicillin allergy. I would want to know specifically what her reaction to penicillin has been in the past, because if she's had a severe reaction such as anaphylaxis, then that may change how I treat her symptoms. In addition to that, I want to know her past medical and surgical history, her sexual history, the number of partners, gender, and her last sexual contact. I want to know her obstetric and menstrual history, contraceptive history, abuse history, and vaccination history. With that, I'm interested in whether or not she's been vaccinated against HPV. In addition, I want to know if she has any itching, sores, lesions, or unusual discharge from her vagina or anus. I also want to know when her last occurrence of vaginal intercourse was, or if she's ever had vaginal intercourse in the past. Next, I would move on to the objective data, and I would start with her vital signs, height, and weight, and now we'll move on to the actual physical exam.
This is my physical exam of Sarah. I'll begin by introducing myself. Hi, I'm Megan. I'm a student nurse practitioner. I'm going to do your exam today, and I'll start by washing my hands first. So I understand you're having sore throat and difficulty swallowing for 3 days.
Yes.
Is that right? Okay, so let's start by looking in your throat. Go ahead and open your mouth for me. So I'm going to assess her throat and tonsils and teeth for cavities, enlarged or swollen tonsils, and a red posterior pharynx with any signs of lesions or exudate. Go ahead and say ah. I would use a tongue depressor and look around. While she's there, I'm going to assess her nose and her nares. Go ahead and look up. I'm going to use the light to look in both sides of her nose and assess the turbinates for swelling, or redness, or any kind of discharge. At the same time, I'm going to inspect her eyes, and I notice that the conjunctiva are clear. They're not injected, and there's no discharge on the eyelids at all. Next, I'm going to assess her ears. So first, I will palpate the outer anatomy, the tragus and the helix, and check for any tenderness. She doesn't have any. Next, I'm going to assess the tympanic membranes and assess for any kind of infection in that eardrum. And I'll do both sides. Any tenderness there?
No.
Okay. And I'll look inside. Okay. Next, I'm going to palpate her sinuses to assess for any signs of sinusitis. I'll do the frontal sinus, the ethmoid sinus, and the maxillary sinus. Any tenderness at all? No. Next, I'm going to assess her lymph nodes, again to test for any signs of systemic infection. I'll start with the pre-auricular, post-auricular, submandibular, and submental lymph nodes, and then move to the superficial and deep cervical lymph nodes, and finally the supraclavicular lymph nodes. Any tenderness at all?
No.
So next I'm going to want to auscultate her lungs. In the event I think she might have an upper respiratory tract infection, I want to assess her lungs to make sure any infection hasn't moved into her lungs. So open your mouth and take a big breath in and out. Good. I'm going to listen for the full inhalation and exhalation cycles. Anteriorly and posteriorly. Big breath. Good. Good. And one more. So I would listen between 8 to 10 times, and I did not hear any adventitious breath sounds at all. Next, I want to take her through a range of motion in her neck, just to rule out any kind of meningitis at all. So I would ask her to flex her neck, so bring your chin to your chest, and then bring it all the way back. Turn to the side, turn to the other side, go back to center, and then try and bring your ear to your shoulder, and the other ear to your shoulder. Any pain or problems moving your neck at all?
No.
No. Okay, good. So next, because of her complaints and her history of oral and anal sex, I would then want to at least assess her external genitalia and anus for any signs of lesions, discharge, foul smell, or any kind of trauma. Also, I'm not obviously going to do that now, but next what I can do too to assess for meningitis are two different tests that we can do. So I'll have Sarah lay down. This will work. Yeah. And first we're going to do Kernig's sign, and that's when I bring her hip and knee to flexion, and then ask her to extend it. Go ahead. And if she has any pain in her low back, that would be a positive Kernig sign and may indicate some meningitis. The second test is where I have her, I flex her neck in a passive range of motion, and I bring her chin to her chest. Good. And if she were to flex her hips or knees, go ahead and show me how you would do that. Like that, that would be a positive Bradinsky sign and may indicate meningitis. Go ahead and sit up for me. I would only address her abdominal system if she had any specific GI complaints like nausea, vomiting, diarrhea, or abdominal pain. I would also ask to do a full pelvic exam so I could assess her cervix in the event that she did have symptoms that might indicate a cervical or vaginal infection or STI. And that concludes the exam.